Researchers in the UK have found a slew of long-term COVID effects among people who have gotten COVID-19. A study of nearly 50,000 patients aged 17 to 87 revealed nearly 60% of them noted fatigue as a long-term side effect of COVID-19. But that's not the only issue people are dealing with. Joining me now is UC Berkeley infectious disease specialist, Dr. John Swartzberg. Dr. Swartzberg, thanks for joining me here. I feel like now that we are a year and a half into dealing with this virus, I'm curious, is it safe to say we're getting a better idea of these long-term COVID effects?
Well, we're starting to get a better idea, but by definition, these long-term effects, we haven't had a long time to learn about them because the virus has only been causing havoc with us for less than 2 years. The fact is, though, that disturbingly, we are seeing an awful lot of people after having an episode of COVID, usually a more serious episode, but not always. Some people who have a very mild episode or even just infection will have these long-term effects. So we're still trying to sort all of this out.
The top 5 long COVID symptoms from this study there in the UK noted fatigue, of course, headaches, attention disorder, hair loss, and difficulty breathing. I'm curious, is this surprising to see those being the top effects from a coronavirus in general?
Well, after a viral infection, for example, after influenza, people feel rotten for typically about 6 weeks, but not months. And that is unusual, and that's one of the many unusual features about this particular virus. The type of symptoms specifically are difficult to ferret out. For example, the difficulty with breathing could have been due to lung involvement during the acute infection, leading to some longer-term problems with the lungs. The difficulty, of course, with smelling is related to the olfactory nerves, or the nerves that relate to smelling. But the confusion, no one's sure what that's caused by. People postulate, could it be an autoimmune problem? We just don't know, and we don't know if it's one cause or multiple causes. Many questions, not very many answers.
Definitely. I mean, you just said that confusion part. Another common side effect is long-term loss of taste and smell. Those are number 6 and 7 on the list there. I actually spoke with a woman today. She's a baker, she's a chef. She lost her sense of taste and smell several months ago, and now her sense of taste is starting to come back. But she says there's almost like there's wires that have been crossed, because she'll try and eat an apple and it tastes like burnt wood instead. Is that something you've heard of, where people are getting their wires crossed when it comes to the taste and smell?
That's becoming a pretty typical story. Our ability to smell things is really incredibly complicated from a neurological level. And it appears that if people lose their taste and smell, and most of taste comes from our ability to smell, if people lose the ability to smell, when it starts to get better, sometimes those wires do get crossed, and the message will come to our brain that this smells like burning wood when actually it's hot chocolate. So and you can imagine how disabling that was, or that is. I know of a patient who recovered from COVID but kept smelling what smelled like burning wood. And she feared there was a fire in the house, but there was nothing there. So people can get what are called phantom smelling, or phantosmia is the medical term for it, where you smell things that really aren't there. Lots of strange things with this virus.
It's very, very scary. I think obviously the main question people are wondering, will these symptoms and effects ever go away? And I guess the answer probably is we're not sure still.
Well, we know a lot of people, for an awful lot of people, it's getting better after many months. We also know that there's a group of people where it doesn't appear to be getting better now after a year. So, unfortunately, the best that we can tell people is that likely it will get better, likely it will go away, but we can't predict when in any individual right now, but the odds are in their favor. What we desperately need is some kind of controlled study where we can take people who have long-term side effects and then have a matching group who also we monitor very closely, because a lot of the things that people complain of are other things that people who haven't had COVID will also be complaining of. That said, there's really no question that there is a post-COVID syndrome, and we just need a lot more science about this.
Dr. Swartzberg, thank you so much for joining us and kind of breaking down some of the issues people are dealing with. Anything else you want people to kind of keep in mind, maybe long haulers who might be watching this?
Well, the main thing to keep in mind is that the post-COVID syndrome is probably preventable by preventing yourself from getting COVID, or most assuredly preventable by preventing yourself from getting COVID. And we know how to do that. Number one, get vaccinated. There was just a very recent study that showed that people who have had breakthrough infections with COVID who have been fully vaccinated, their chances of getting this post-COVID syndrome are far, far less than people who have never been vaccinated. So that's number one. Number two, we can prevent ourselves from getting infected by practicing what we call the non-pharmaceutical interventions. Wear a mask when you're outside, indoors with other people, and if you're outside around other people, wear a mask. Try to social distance. Try to avoid congregate settings right now in the face of a surge. So these are things that you can do to prevent getting infected in the first place. If you're vaccinated and you do get a breakthrough infection, the chances of you getting this post-COVID syndrome are far, far less. Get vaccinated.
Definitely. Dr. Swartzberg, are you there at UC Berkeley? Are there any studies going on about long haulers specifically, or any of these specific symptoms?
Well, there are studies nationally going on. I'm not aware of any at my university, but there are some studies nationally going on to try and look much more carefully, not only at the symptoms that people are getting, but at the cause for them. That is, what is happening to people after the virus is long gone? Why do they continue to have brain fog? Why do they continue to have exhaustion? These are things we don't have a good answer for yet. If we can find the answer to that question, then we can find a way to prevent that or to treat it. So lots of studies going on nationally and internationally. You know, everybody's very interested in this. Of course, the person who's suffering from it is most interested, in the families those people come from. But as a society, if we're going to have a large group of people with this post-COVID syndrome that are partially, moderately, or even fully disabled from that, this is something from a societal standpoint we all have to pay attention to and address, because it's going to be a burden on the families, on the community, on our entire society. And we have to find a way to deal with it effectively.
Definitely. Dr. Swartzberg, thank you for joining us this afternoon. I appreciate it.